Hi, I'm going to show you 6 movements that are helpful if you're having issues with your shoulder, whether it's from impingement of the shoulder or from improper use of your rotator cuff. You could have pain or inflammation underneath your acromion, and there could be neck breathing as well. So there's a lot of different things that could be happening. So I just want to show you 6 movements that could release the pain. You want to keep in mind that these 6 movements need to be performed consistently. 3 times a day is ideal. Give it about 7 days. See if there's any release in the discomfort and see if the rotator cuff muscles can start to be in a position where they move your shoulder and your humeral head in a proper function. So I want to start with just a stretch. We're going to do 2 stretches and then we're going to do about 4 different exercises to strengthen the proper usage of your shoulder joint. You ready? Let's start with the stretch in the doorway, hence why I'm in the doorway. So I want you to start with your hands down so your arms are more at a diagonal. And you're gonna walk like you're walking forward through the doorway. So your legs are gonna be staggered. And you're gonna start to hinge forward at the waist. So you'll feel the stretch at the front of the shoulders, maybe even feel the stretch in your biceps. I want you to take 3 deep breaths here, being mindful of the neck, and take that pie face. So you're getting the double chin. And then release. Let's do that one more time. So when you release, wiggle it out. Be very careful that you're not breathing into your neck or using your neck to breathe. Use your belly muscles, use your diaphragm. This is all these movements are also to help train the diaphragm on how to help you breathe. Lean into it. The hands are not gripping the doorway. You have flat hands so you can feel the stretch all down your arms. And you get that double chin. And then release, wiggle out the hands. Now we're going to put our arms up high and do the same thing. We'll step through the doorway, feel the stretch, get that double chin. Deep breath into the belly. Let that breath rise up into the chest ever so slightly, getting the diaphragm to move in its natural position it's meant to. So the neck does not do the breathing for you. Sometimes the neck will do lots of breathing when we're doing chest breathing. And then switch sides. Notice the scapula coming toward your spine when you're doing those exercises. All right, now we're going to go into a different position. So for the second part of shoulder rehab movements, we're going to do one more stretch and then we're going to do 4 poses that will isometrically engage your shoulder joint without any weight bearing. Okay, so we want to do small, precise movements with no weight. This whole little video is for an acute flare-up moment. Okay, so this is not the movement that you're going to be stuck with forever. I want you to remember that. And that the more consistent you are with these really precise, small, no load bearing movements, the more possibility you will have in the near future to bring the load back in. Okay, let's get into our quadruped position, like a tabletop. And I want you to do that kind of like Halloween scared cat position. Like really emphasize the rounded spine and drop your chin so you can stretch out the back of your rotator cuff muscles. So you're stretching out. Take several deep breaths, round your spine a little bit, draw your pubic bone towards your face. So you're rounding and like hollowing out your belly. And then take a breath to relax. And then do that again. Round the spine, protract the shoulders, trying to lift the back body all the way up toward the ceiling. Bring those inner elbows to face forward. 3 deep breaths and relax. Let's do that again.
protraction, rounded spine. You got that Halloween cat position. Chin stays tucked. Forehead drops down. Crown of the head down toward the ground. And release. So now we're going to sit in a staff position with the legs extended out. We're going to mimic rowing. So I want you to start strengthening the pectoralis major, the muscle, the bicep tendon that might be doing a lot of the work for you. We're going to start to open up this impingement. So pretend you're grabbing a strap. This first one, I just want you to pretend you're grabbing a strap. When I'm saying isometrically engage your legs, flex your legs so much that your heels lift off of the ground. And then engage your belly. Brace your belly just for this moment. You're going to release the brace after this, right? We talked about this, that you don't want to have your belly engaged all the time. So when you do want to engage it, you can. Okay, I just want to line up for the camera a little bit more. Okay, so here we are. We're going to pretend a row. Thumbs are facing up. The fingers are all facing forward. There's no curve in the wrist. We're going to inhale and exhale, isometrically engage. Draw those elbows as far back as you can. Inhale for extension, exhale, engage. Tongues on the roof of the mouth. Breathing using the diaphragm, not the front of your neck. And one more. Great, now we're going to go into a prone position. So that's facing down on our bellies. So we're going to lay all the way down and work on the rotation of the shoulder. So as we're laying down, we're going to tap the forehead down or the chin down. I'm going to have my forehead down just so I can use my microphone better. And now the elbows are at a 90-degree angle and your forearms are parallel together. So what I see, this is the goalpost arm, okay? Take goalpost arm. What I want to avoid is wrists doing anything funky, okay? Or elbows making a bigger angle or a smaller angle. Keep your elbows at 90 when you're on the ground. And what we're going to be doing is lifting our forearms off of the ground, not just the hands, not just the wrist, the whole forearm with the wrist and hand lift up, okay? So you're going down onto your face, belly down. We're going to do 10 of these. We're going to inhale, lift up, exhale, set down. In. Let's do one more. Okay, so even the range of motion that you can get there is giving a lot of information. If you can barely lift up, that means that the impingement made it so there's no more range of motion. So now let's lay down on our backs. So that was row. Okay, so now we're going to do the forearm lifts. Okay, so let's lower down. Let's start with the feet planted on the ground. Okay, feet are planted on the ground, knees are up. I want to make sure that we're breathing in the belly. Take some deep belly breath and keep the lower back engaged. Okay, so this first one, I want to make fists. Remember, we're isometrically engaging. We're going to open our hands and close our hands. Open and close. Remember, these are supposed to be, you're feeling like 50% of sensation. This is not supposed to be an intense workout. The elbows are at a 90. The wrists are not moving independently. You're keeping strong fists because we're isometrically engaging. I want to make sure the belly is breathing. 10 of these. We're going to do these all 3 times. Okay, now you're going to put your elbows up. Okay, so elbows up just like when you were in prone, but now we're in supine. Elbows up at a 90-degree angle. You're going to lower your arms down and lift them up. Nice. Notice if when you go down, the shoulder heads lift up. Maybe that feels like a nice stretch. Keep the scapula down and just go as far as you can. One more. Great. And then draw your knees in. You can roll up, you can sit up. So then we're going to do those same exercises again. We're going to go back to doing the Halloween cat. We're going to row. Okay, let's go. Halloween cat. 10 cycles. If it feels really good in that stretch, maybe you hold it a little bit longer. Stretching your shoulders. You know, the inhale is rather quiet, but let that exhale have some vibration to it. Okay, now sit down into a position where we can row. So you're going to flex, isometrically engage, pull it in, and release. Yep. And let's move on to prone. Forehead down or chin down. For me, I'm going to have my forehead down so my microphone doesn't get messed up. Keep your elbows down, lift up and down. You want to feel that engagement. The shoulder that's bothering you is probably going to have some sensation here. Don't run away from the sensation. Investigate the sensation. Ask yourself if this is aggravating or if this feels good. Not every movement is for every body. Last one. And then press up. Let's go down onto our back. Right. Arms down by your side to begin. Elbows hugged into your waist. Make a fist. Open and close. Keep those shoulders down and breathe in your belly. This is really just to retrain the muscles on how to work with precision. And then when you do more playful, silly, random movements, your body's going to know what to do. Now we're going to take the arms up into that goal post. Let your hands go down as much as you can. I like to play with how much feels good. It's always interesting. And then going down to the point that feels comfortable for you. Feels like an interesting range of motion. Maybe you pause and listen. Maybe you keep your scapula down.
Just go enough so that and with the scapula staying down. Breathe in and out of the belly. Let the diaphragm do the movement for you. Don't be breathing up into your chest and your traps. This is just a relaxed breath. This is just my elbow clicking on the hard floor. That sound that maybe you can hear. Okay, so that's it for your movements. Start in the doorway, then do your tabletop. Then you're gonna row. You're gonna lay on your chest, get into goalpost, lift and lower. Then you're gonna lay on your back. You're gonna do the external rotation. And then you're gonna come back in a goalpost and try to lower your hands down. Okay, so do that one more time. I want you to be doing 3 sets of all these with about 10 reps of each one. Try to do this 3 times a day. Thank you for practicing, and let me know if you have any questions.